My name is Marie. I'm going to be doing some medication prep for our patient today, Martha. She's on several medications and we have to administer them this morning. So the first thing I'm going to do is come in and perform hand hygiene before I drop these medications. I am in a no talk zone of medication prep, so that way I'm not bothered. And I will have another nurse double check on my math after I'm done. So I'm going to glove up. And the first thing I'm gonna do to get ready is the fluoxetine. It is a tablet, and the available dose I have are 20 milligram tablets. I'm gonna prep them out, pull them out of here. These are 20 milligram capsules, and I'm gonna just inspect, check the expiration, make sure that there's nothing wrong with them. And we'll be administering these to the patient. So we have, what we want to give her is 60 milligrams. What we have on hand is 20 milligrams. And that will equal 3 capsules. So that one is good. The next one I'm going to do is insulin for her diabetes. We have 2 different forms. We have an intermediate and a rapid insulin. So let me pull these out of the cabinet here. And I will mix up the cloudy one and we'll clean the lids. And so, excuse me, the insulin are in units, and what they want for the MPH is 10 units and wanted for the List Pro is 2 units. And I did double check the expiration on these as well. And so I'm going to first clean the bottles here. And I'm always making sure that I have a sharps container nearby when I go to pull up this med. So I have my label ready for my insulin. This is going to be the label I put on it for insulin, 10 units of NPH, 2 units of regular for Martha, making sure I have that right. And I'm going to inject in the order first with air, cloudy, and then clear, and then drop the medication in the order clear, then cloudy, just as to not contaminate. And the needle is already on this syringe. And I'm gonna first inject 10 of air into the cloudy. Oops, injecting air here. And then I'm going to inject 2 of air into the clear. And I'm going to pull 2 of this one up. Watching for air bubbles here real closely. And then I'm going to pull up 10 of this one. I'm double checking my dose here. Then I will recap here. Okay, I'm gonna label that, my insulin. So we have these. Next, I'm gonna do the ceftriaxone for her UTI. And so I'll pull that med out. This is gonna be a reconstituted medication. And I'm gonna check the expiration date on this, and then I will clean the vials with my alcohol swab and clean these really good. Don't want to get any contamination. I did double check the expiration date. I wanted to make sure. Ceftriaxone. All right, and the medication I have available is, that's not reconstituted yet, is 350 milligram per 1 ml. And so the math that I'm gonna do here, real quick before I draw this med up, we want to, let's see, 0.5 grams, and we're going to convert that to milligrams because that's what we have available. And 1,000 milligrams is in 1 gram, so we're going to have, or want 500 milligrams. And so the want is 500 over the have is 325. Let me double check that it was 325 that we have. 350, excuse me, 350. And that unit of vehicle is 1, and so we will be able to have 1.4 ml is what we're going to be drawing up here of this medication today, but we're going to reconstitute it with 2.1. So, and like I said, I will have another nurse double check this. I did clean these already. And ideally, if I had it available, I would probably drop the medication with possibly a filter needle just in case there was any glass. And I also would probably drop the medication and then switch needles just so that it's nice and sharp when we do administer it to the patient. And this medication, so the insulin will be subcutaneous and this medication is going to be intermuscular. And so we do have a needle that's 22 gauge and 1.5 inches long. So 2.1 is how much air we're gonna put in. And I make sure there's nobody around us too, because I don't want anybody around when I have needles out. So I'll put an air in. Then I will draw this med up. 2.1, which will be reconstituted into the other solution. Don't want any air bubbles here because then it's not as accurate. So accuracy is everything. And I will probably open the sink, get that air bubble out, and then just double check my dose. Still 2.1 to be reconstituted. These are already clean vials. And again, this is where I would probably have a new needle. But I'll just recap it for now. Now I'm gonna reconstitute this med, and we're rolling, not shaking, until the med is not clumpy at all. And I'll double check, just make sure it's nice and mixed because I don't wanna give the patient anything that's not mixed. And so again, with my new needle, now I'm going to draw up 1.4 mLs. So I'm gonna insert the air. 1.4 is right there. And this med, be very careful here because it's yellow and it's gonna get all over my clothes. So try to get my bubbles out. And depending on the medication, we might keep that air bubble, but for these ones, we don't want the air bubble here. And the trick they taught us is with the pen. And I will show the camera, that's 1.4. And then I'm going to draw this up here, recap, being very careful not to recap in my hand, and that label out, okay? Next we have cyanocobalamin, and this is medication is for her B12 injection once a month. So I'm gonna check the date on it, pull it out of the cabinet, make sure it's not expired, and the medication we have available, let me get organized here. So for this is for Miss Martha. It's 1,000 micrograms per milliliter, and what we want is already in micrograms, so it's in 200. So we want 200 micrograms, And what we have is 1,000. And we're gonna multiply this by the vehicle, which is 1 ml. And that will equal, my math here, 0.2 ml. And we're making sure to do the 0.2 dose here. I'm gonna double check. Yep, okay. And I did double check the expiration, so I will clean with a new alcohol swab. Just clean the bottle. Okay, and so we want 0.2, and we're very careful here on this one. It's a small dose. And we're gonna first inject air, and then that's just to pressurize the bottle we have here. And I'm gonna drop 0.2. I'm gonna drop a little bit extra because it's such a small amount, making sure there's no bubbles in here. To recap here, just very carefully. And I'll show it's at 0.2, and that's not a bubble, it's just between the syringe. Label that one. And then the last, those are all the medications we're going to administer, but the last thing we're going to do is a TB test. And so I will get my TB out from the cabinet. This is the tuberculin medication that we're going to insert just intradermally to check the patient for TB. So I'll take this out, and we do have the correct dose on hand. It's the 0.1 ml is the test dose that we're going to do for her. So I will clean this with a new alcohol swab. Clean. And again, it's 0.1. And this is a TB syringe here. And pop the needle off here. 0.1, and these are so nice. And accurate. Accuracy is everything. We're going to inject the air first. Very carefully here. Make sure there's no bubbles. All right, perfect. And we'll recap before we head to the patient's room. Scoop that up. They're always kind of a pain. All right. And we will label that one as well. Sorry, let me show you. Quick one. And label that. Now we will head over to the patient's room, and I'll make sure I clean up all this mess. Knock, knock. Hi, Martha. Good morning. I'm Marie, and I have some medications that I just drew up that we're going to administer for you today. The first thing I'm going to do is provide privacy. Shut this door, and then I'm going to wash my hands here, and I'm going to check your name and birthday. What's your name? Great. And your date of birth? Perfect. All right, so Martha, I have already done the 3 MAR checks. I had 2 of them, excuse me. I did 2 at the med station. My third one, I'm checking here. I have the MAR, and I'm just making sure the meds are for this patient with her birthday. And again, just checking the expiration dates and things like that. So the next thing I'm gonna do is check our patient rights. So I'm gonna make sure on each of these medications, I have the right patient, right dose, right drug, right route, right time. So this is all morning. We're gonna make sure everything's in the morning. And after I do all these things, I will document. So I have washed my hands, and the next thing I'm gonna do is apply some gloves. And so Martha, I wanted to find out, are you in any pain today? From a 0 to 10, do you have any pain? Okay, good. I wanna find out how you're feeling. I know being in the hospitals can be kind of challenging. And I know you have a history of depression, so I just wanna make sure I open the window so that we can have some light coming in for you. But if you are feeling sad or anything, I want you to use your call light and let me know, because I can come sit and talk to you, and maybe we can call your daughter and get her on the phone too. So the first thing we're gonna administer this morning is your fluoxetine, and it's a capsule. Are you able to swallow capsules okay? Good, okay. So we're gonna sit you up and just make sure you're nice and sat up, and I'll give you some water. And this medication's for your depression. And so what I wanna just talk to you about is just, again, make sure you let me know if you're not feeling good while you're here for this day, because we wanna make sure you're feeling okay. I know it's hard to be in the hospital. So I'll give you this and some water, and I'll let you swallow it. All 3 pills. And then I will just make sure and check your mouth. Make sure you swallowed it. Perfect. And here's some more water for you. Great. Again, and I did the patient, all the patient's rights, including the indications on that. So the next thing I'm going to do is going to be her injections. So the next injection we have for Martha is for insulin. For your insulin, Martha, obviously you have a history of diabetes, so the things that I'm going to educate you on, you're probably already aware of. We're only going to poke you once today. It's going to be 2 inches away from your umbilicus, and we're going to make sure we rotate sites so you don't build up some scar tissue. With your diabetes, we want to make sure you're checking your blood sugars regularly, and we'll probably come back in a little bit and check it. And we're also going to be monitoring for any signs of injection site reaction. The side effects, that's probably maybe the most common one we would see with your insulin injection, but we will monitor you for any variations in your blood sugar levels. Also with your fluoxetine that you just took, you might have a little bit of dizziness or nausea, but hopefully it'll be mild for you. So first we're gonna do your injection for your insulin. Again, I just wanted to stress the importance to you of your diet and exercise. Make sure you, if you can, maybe we'll get up and go for a walk later today. And we also wanna make sure you're doing a diabetic diet and we're checking your blood sugars regularly. This medication, it's not going to cure your diabetes like we talk about, but it hopefully will help control your blood sugar levels. So we have mixed your insulin, and we have 12 units today we're doing. We have 10 units of NPH and 2 units of regular insulin. Okay, so the first thing I'm going to do is clean the injection site. Again, this is subcutaneous, and we'll do it on the right side of your abdomen. And I probably will make sure the patient too is, I might even have her try to show me that she can do it just to make sure she does it okay at home. But I'll clean this. I'm gonna clean this good here. Okay. All right. Quick poke here. And then we'll leave the syringe in for a few seconds. That safety needle there, throw in the sharps. Okay, so now I'm gonna document that we did that. So that was, we did your fluoxetine at 0800. Do my initials, and that was by mouth. And then it was 0802 when we did both of your insulins, and I'll do my initials. Okay, you feeling okay? Okay, I'd probably give her a little bit of time in between each of these injections, just because I don't want to cause her too much pain by poking her and prodding her. But for the sake of this video, I'll do one after another. The next medication we're going to do is your ceftriaxone. This one we're going to give you in your ventrogluteal site. It's an intramuscular injection. It is for your UTI. Any side effects of this medication, you know, you might have a little bit of nausea, headache, dizziness, but we'll maybe keep you in bed for a little bit just to make sure you handle it okay. With an antibiotic, you should be in the hospital getting these regularly, but we're going to make sure you finish your full course of your antibiotic. We don't want to cut you short. And we will probably also encourage you to make sure you're drinking lots of water for your UTI and, you know, monitoring you really closely. Do you have any pain still with urination or anything? No? Okay. All right. Well, we're going to watch you really closely, okay? So this is going to be your ceftriaxone, and we did reconstitute this one already. It's 1.4 mils. And so I will clean the injection site. It is intramuscular, and this one's a little bit of a deeper injection. So, and this would be on her ventrogluteal area. We will clean the site. And in some practices they do aspirate, but in our book it doesn't mention anything about aspirating, so we won't aspirate today. All right, quick poke. 90-degree angle here. All right, doing okay? Okay, perfect. We have a needle safety cap. Perfect. All right. And if I had gauze, I'd probably hold the gauze on it just to make sure she's not bleeding or anything. Again, I'd wait quite a bit of time before we do the next thing because I don't like poking her too many times. We're feeling good, and I will document that now. And as I have explained these to the patient, making sure that she knows that her rights are also that she can refuse any medication if she wants, and that she has the right to know about every medication we're giving her. So that's why we're giving her really good education. So it's 08. 05 now. Okay, we have 2 more meds for you today. And I probably also just might even change my gloves in between each med, just depending too if they were soiled or anything, just making sure we're staying as clean as possible. And again, I am double checking the MAR, each medication with the patient, making sure I'm going over it really thoroughly. So 2 more tests. Let's do we're gonna do the TB test next. So this test, Martha, is for tuberculosis. Have you ever had one before? Okay, so as you remember, we kind of get like a little bleb, and you'll have to come back within 24 to 48 hours, pardon me, 48 to 72 hours and have it read. And we'll see if you have been exposed. But since you're here in the hospital, we'll just check you. But make sure you maybe help us remember. So we're gonna check you to see if you've been exposed to TB. With this shot, you might have a little bit of injection site reaction, maybe a little bit of redness, but hopefully it's mild and hopefully you haven't been exposed to TB. But we will check you. All right, so clean the site here. So with this injection, I'm gonna do it on our forearm. Right here, and it's gonna we're gonna create a bleb. We'll be injecting this medication at a 5 to 15 degree angle, and with the part of the needle up here. All right, quick poke. All right, I did not get a bleb on this, so I will probably redraw up that med in just a minute. But I'm gonna redo that, sorry to poke you twice, but I will do your next med and then I'm gonna come back after I redraw up some medication for you. So the next med we have is your cyanocobalamin, which is your vitamin B12 deficiency med. With this one, you might have a little bit, we're gonna do it your deltoid. You might feel a little bit nauseous, but hopefully it's mild. And since you get it once a month, you're pretty used to it. So we're gonna clean the injection site here. And I will document that I did one TB and that I didn't get the bleb, so that we're gonna go draw it up again. So make sure my strips are open. And then I'm making sure the patient dose everything. This is gonna be in your deltoid. And we're gonna do it at least 3 fingers down and feel for the muscle. This mannequin is pretty small, so we'll make sure we kind of don't go all the way too deep into her body. We don't want no bone. And this one is 90 degrees as well. Perfect. Okay. All right, Martha, I will be right back with that other TB injection, okay? Martha, I'm back. It's Marie. I'm gonna do your TB again, okay? Sorry about earlier. I really feel bad. I'm a student nurse though, so I will provide you privacy, shut the door, and I'm gonna wash my hands, and I'm gonna do all the stuff I just did again, confirming your patient, make sure to check your band, make sure all the rights are right, patient, dose, drug, route, time, document, indication. And then I will put on gloves. So we're gonna get a blub this time, I can feel it. So, and I will have called the provider. I'm just gonna let him know that I messed up. That's an important part of nursing, is just owning when you mess up. So, all right. So then I did label my medication when I brought it in. And again, we're doing this on the forearm, and we're gonna do it at a 5 to 15 degree angle. And I will clean it with an alcohol swab. All right, there is the lid. All right, Martha, it's gonna be out of your hair, and I will clean up my medications, everything here, and document that everything went well. I will document all these sites that I did all those injections at. And please call me. I'll be back in just a little bit to check on you since we did so many injections. Thanks, Martha.